Hi, Jana. Thank you so much for joining me for Tuesday Tea. How are you?
It's an honor, Taína. I'm good. How are you?
I'm good. I'm so glad that you decided to join me in this conversation that I feel that is just so important, especially as we're thinking about how therapists interact with parents.
Completely.
Why don't we do our own intros today? Jana, would you like to introduce yourself?
Yeah. So, normally in a professional role, I'm a licensed professional counselor and try very hard to help change the trajectory of people's experiences of trauma. Work a lot with trauma addiction and perinatal mental health. Love teaching that through brain spotting and other evidence based approaches to help find healing. But today I'm here more as a parent um, of beautiful 10-year-old twin girls, and just to talk about some of the realities of what it's like balancing professional life with personal life, with parenting life, with spousal life, with being a friend and a child myself life to other parent, right? Like being the child of my parents, etc. And just kind of what how that translates into real life and real talk. It's kind of vulnerable, but I think it feels good to push my capacity because I'm usually talking about other people. So it's interesting coming in and talking about my own life experiences.
I love that. And I really feel like all of these life experiences that we have really lend this richness to how we deal with the people who we work with. Similar to you, I have twins. They're a bit younger. I also have some older stepkids, and I have not only just some medical needs that as a parent I just kind of parent around for my kiddos. There are also some intellectual and neurodivergence needs. So I'm always questioning myself, like, am I doing the right thing? What does this look like in other households? Am I slowly going insane? How do we balance all of these things and make the right decisions for kiddos? So for me, and I'm sure for you as well, it's really about how it's not about the kids themselves, but really how are we parenting and then what messages are we sending to these communities? Because I know a lot of parents who say, I just don't know what to do.
Yeah.
So can you talk to us about like the psychological gymnastics and the kind of some of the tough sides. We will definitely be talking about some of the joy and the beauty
Yeah,
because I know you love your kiddos and I definitely love mine. Um,
definitely.
but I don't want to do the how do you say, like, the positivity of like everything's going to be fine. No, some days it's not.
No. And I guess kind of looking behind the scenes, that there's a lot of different challenges when you are parenting kids who have any type of differences, really, but especially kids who have different sensitivities, whether that's noise sensitivity, whether that is sensory on clothing that's being worn, whether it is anxiety about entering into a new situation that isn't challenging for other kids. And so it's trying to have space for self compassion on this being harder for our family or our child than it is compared to maybe some other families or children. And trying to also manage others' expectations around how something might go, especially in a group setting, while trying to stay calm and grounded, even when things are feeling overwhelmed, and being able to show up and meet the needs of your kiddo, even if your own needs have not fully been met in that moment or that day, or maybe even that week. So it's kind of mental gymnastics around that, and having a community of people who do understand and who are more kind or patient, I think is part of the key. But there's challenges in various settings, including the medical ones, right? Like the people that we go to for help or assistance professionally, some of the things that they think or say or believe, it sometimes is kind of cookie cutter. One of the challenges in my family is sleep. And so, we sought out expertise for the best pediatric sleep specialist neurologist in our city that we live. And we went through all the diagnostics and we did the overnight sleep study in a space. And, we got their feedback and we followed their kind of course of treatment, if you will. And, once medication didn't work, because for my kids, some medication is paradoxical, which means that what you think is going to happen, the opposite actually occurs. And so they were giving a prescription that should have chilled her out and helped her sleep. But in reality, it made her ultra hyper and made sleep even harder. And so after going through every step asked of us, we were told that there was nothing more they could do, that they were going to just discharge us, that some kids are just not good sleepers, and yours is one of them. And so we're 10 years in, and it's very rare to get a complete night's sleep due to wake ups by my kiddo. And, it just creates another layer of challenge because it's harder to stay calm and grounded both for me and her and the rest of my family if we haven't gotten proper rest, right? It's so foundational for having patience. And so, how to try to get the self care in place needed so that even if you didn't get a good night's sleep, that you're still able to show up, try to be calm and grounded. You don't get it right all the time, and help your kid regulate when that's really, really hard for them because of whatever's bothering them, plus the lack of adequate sleep, or at least the length of it. That other kids usually would be able to get more easily. And so, these are just real life things. And there's just a lot of challenges that, you may see us after the challenge and it looks like we probably had a smooth morning, but likely we did not. You are muted. Sorry, I just couldn't hear you.
Thank you.
Uh-huh.
Uh, so I definitely, Hunger Games salute to you in terms of the sleep, because that is something that is not often had in this household, or at least not at the same time, right? So people are sleeping when they need to sleep, little people, and me as an adult is not necessarily always sleeping when I need to sleep.
Mm-hmm.
So that kind of brings me to this question around like the romanticization
Mm-hmm.
of what it is to be a parent when your kids might have different needs than others. So I get a lot of, oh, you're the best parent. But they're not saying that because I'm doing the best I can, right? I would say the best parent is the parent who's doing the best that they can.
Mm-hmm.
But I think that there might be some different reasons that people are saying that. And I wonder how you manage that, not only for yourself, but for your clients when people are um, just kind of putting forth this idea that poor you or things are so hard. When sometimes that's the truth, but that's not the whole truth.
Right. Yeah. I mean, I think a lot of it is just your own understanding of the challenge and recognizing that if people do not face neurodiversity, neurospiciness, whatever you want to call it, within their own families, then they really don't understand. And that's okay. Like, I don't know if the goal is like, sure, if they're close to your family, you want them to understand, but being able to highlight, the beautiful pieces that come, and the wonderful kids that our children are, even despite and usually because of the challenges that they have to overcome, and being able to highlight and recognize those moments as well, because almost every child has some strength, some talent, something that makes them unique and special. So helping them see that. And
Mm.
then honestly, when people are like, how do you do it? you don't have a choice, right? Like
I
it's
do it poorly.
you said like you always say I do it for, but it's like I do the best I can do. And you don't know what you're capable of until you're put into different situations. But then you just feel really compelled to move forward and determine the best way to make things easier for your child / your family, because that's the biggest priority. As hard as it is to manage the different challenges that may come up, it's even harder being the person who's living the challenge, not just supporting the challenge that's happening. And so, being able to find the relief, even if it comes at funky times, I have learned about this somatic therapy where you go and learn specific dances that help regulate the nervous system. And so I signed up, and it's about 30 minutes away from my house, and it starts at 7 a.m. during the week. So, so like when you're in a household where sleep is hard to come by and waking up early already is hard, right? Like, but it's like you figure it out for your kid and you make it work. And it's not about like, oh, good for you. It's like you have to have the solutions, and that's when it's being offered. And so that's when I'm going to do it. And, making that work within our whole family system for the greater good. Right. And, other people won't understand those challenges. But like I said, they also don't get the rewards of the goodness of the positive moments with any kids, that aren't theirs. And, I just hold on to those precious, precious moments to be able to get through the harder ones. And, always reminding myself, like, my child is not trying to give me a hard time. They're having a hard time.
Yes,
And there's
repeat that for those people in the back.
I know, right? Because in the moment it feels like, oh my gosh, you are giving me a hard time. It feels that way. But in reality, they're not. My kid is not trying to give me a hard time. They're having a hard time. And they need me to show up in a way that makes that easier and better, and that they're able to feel like they can rely on me to help them navigate out of the difficult space they're in, whether that's overwhelm, whether that is anxiety, whether that is sensory, or something else, being able to do that so that you can find those solutions. And it is very rewarding when you figure out something that works in the moment, even if it's not going to work the next moment. It feels really rewarding at the time to be like, oh, we got through this. Like, we figured this out. We made this better. And now we can see how we can use this in other ways next time.
What I love about the way that you describe that is that I have a friend who is also a trauma therapist who said to me a year or two ago, as my kiddo was navigating some health stuff, and his personality was coming out because no kiddo wants to go through health stuff. She said, Taína, you don't have to understand it. You just have to survive it. And you have no idea the person he's going to be on the other end of this. He's probably going to be a leader. He's going to be she has this idea of where he is. So sometimes when I get frustrated with my child, I'm just like, you're not the president yet.
Like, you will be.
I have no doubts that he will do wonderful things, but in the moments of, just like, yikes, nobody understands. And the other layer that I want to add to this is oftentimes, or at least before this, even though there still wasn't this like collective understanding of what this is like, because we don't really live in those villages in the US, there wasn't this cut off moment where parents faced where we didn't have access to other people. So what did that even look like for people during the pandemic and the quarantining and all of that good stuff?
Yeah, no, I mean, I think that's been made pretty clear that, especially when you are facing any kind of challenge, we're not as humans meant to do that alone. We utilize each other for support. and to get through difficult things. I mean, it sounds overused now, but that whole "it takes a village" is true. And so, COVID really put us in a position where if we utilized our villages, we might hurt our villages, right? Like, I'm lucky enough to live in the same city as my parents, but, it seems like a long time ago now. But at one point, we were afraid of seeing them, that we might give them the virus and they might really not make it, right? Like, and it felt like, oh my gosh, right? Like, we'll drop this off at your front door, but like, don't see us. And so when you've got people who are close and you're used to, and all of a sudden, it's phone calls and Zoom or FaceTime, it really changes a lot. And how people got pushed towards being more independent and figuring it out themselves. And I think that kind of makes it harder coming out. I mean, I guess we could debate if the pandemic's over, depending upon who you are and, the immune systems within your household. But in general, the city I live in, most people who are immune healthy are acting like this never happened. But I think that there is a effect from having to do it by yourself for so long, that I think it's harder to call on others for help, support, and assistance. And we just get used to it. I mean, I think about you have twins as well. Pre-pandemic, there were times where I'd have packages in my hand and a stroller, and I would go to open up a door and someone would be like, "Can I help you?" And I'd be like, "Oh, sure." Right? Because I'm so used to having to do it all that it felt really weird to have someone say like, "Oh, well, let me hold that door for you." You know? And so it's a snapshot of a moment, but now I'm saying, I think in the pandemic, people didn't have alternatives. And so now I think it's harder, but like trying to push your own capacity to reestablish or continue those villages, because this is really hard. And having people who at least understand or who can help out is really huge. And, my child, if they're not super, super comfortable, a lot of the behaviors aren't seen. And so someone will spend an hour or two and they'll be like, "They're fabulous. What are you even talking about?" Right? And they are fabulous, but they also weren't comfortable enough to let you see some of their challenges. And so rather than comparing and saying, "Your kid doesn't do that with me," being able to recognize like that there's kind of a cost associated, and that, the balance of them working really hard to show up a certain way in front of you will likely swing back the other way when they're home.
Yeah.
Because it takes a lot of energy to conform to whatever expectations are had, whether that's at school or at an activity or a friend's house or a sport. Kids who have different challenges, it takes a lot more energy to fit in that box for that period of time. And so once they are out of that situation and in their home with people who love them, that's when you often see a lot of emotional expression, a lot of challenge, a lot of difficulty. In my household, it's acting a lot younger than they are, right? Like, and wanting help and assistance. I've learned it's the way of feeling cared for, but it's very hard when I'm asked to help with something that they're more than capable of doing.
Yeah.
Right? Like, and finding that balance, and usually adding to whatever exhaustion I'm experiencing is they're saying, "Help me get ready for bed," and balancing out the times that I help them get ready for bed versus the time that I'm like, "You need to do this yourself," right? It's always an ebb and flow, and trying to read the situation and being able to like hear it as, it's not that I want to bother you, it's that I need to feel cared for.
Yeah.
So I need you to help me get ready for bed. And
I'm just kind of wondering what that looks like in your household, because at least I can say in my household, while I have a loving partner and father of my children who is an amazing human being, he needs to be out that door by 6 a.m.
yes.
So how do you balance that with also having um, your own responsibilities in your own career and your own life that you're participating in while your kids might not be home.
Right. And I mean, I think it's always like a constant practice of trying to carve out time, to do things that work well for me to stay calm and grounded. I have a husband as well. He's wonderful, but he also has a certain capacity for things. And when he goes outside of that capacity, he has to step away. And that doesn't always mesh. That's just his need and his personality. That doesn't always mesh with the current situation at the current time. And so that can be challenging because there's times that maybe I want to tag out and he's not able to tag in.
Right.
And so it's being able to get through a moment as creatively as possible, and trying to support each other as much as possible in our capacities. I just have a wider one. I think some of that is upbringing, and I think some of that is always being pushed. And, you know, we joke, but it's true. Like when the chips are down, they only want mom.
Mm-hmm.
And so like daddy won't do. And so it in that dynamic may be opposite in other homes, but there's times where my husband will step up and respond and is met with no, I only want mommy, and mommy's the only one who understands, right? Like, and like on some level it's really sweet, and on the other level it's like, gosh, being the start, middle, and end of everything can be really draining.
Yeah.
And then we do this work with people, right? Like where they very few people come into our offices to tell us that they've had a fabulous life and that they just needed someone to witness that. So it, in some ways, it's really with someone else kind of gives you that reprieve from your own life in some ways. And being able to feel competent in your scope of practice, I think helps a lot.
Mm-hmm.
Even if it contrasts sometimes with how you showed up as a parent, right? Like, because I think we've all had moments where we've given advice about parenting or something else that we were like, and I need to take that myself, right? But I think it's a lot of self-compassion
Mm.
mixed with the outlets that help release emotions and, you know, different feelings that I have, so whether that is making a point that when my kids is at, an activity, making sure that I'm walking or
Mm.
listening to a podcast or doing the things that help me feel more regulated so I can show up again in a way that I'm like, wow, you did that. Good for you. But also knowing some days we don't get a do-over, but like let's just rush to bed and start all over tomorrow and that tomorrow will be better. um
Yes.
that's all you can really do. And so it's just finding even those small moments to be able to recharge even a little bit, and and finding the things that help you feel calm, grounded, regulated. Whether that is just simple deep breathing, whether that is a little kit you keep in your purse to be able to, or your backpack to be able to rely on, to be able to say, okay, this is my moment, even if it's only 5 minutes, that it really helps. Because, parenting is nonstop, and that you never know what's going to end up being needed from you when. But what I'm super clear about, especially around transitions, my kids really do not care what kind of day I've had.
Mm.
They want me to show up at 100% capacity for them, or do a really good job faking that, right? Like
Oh, 100%. And I also just want to acknowledge like the partner aspect of that you bring into this, because for those of us who are lucky to have more than one adult in a household, um, I call it teamwork. And there are things that I don't want to do that my partner does really well. I don't want to do emergency first aid stuff. I don't want to be in the ICU. I don't want to be just some of our stuff is medical. I don't want to be in a place where blood transfusions are happening or anything like that.
Mhm.
But if there is a 3-week hospital stay and it's long and boring, I will take care of that. So it's like, what are the things that we're each good at, and how do we play off each other
Yes.
to create that space where we can be, I want to say, like as regulated as possible, because some of those situations are not fun, but as regulated as possible with as much sleep as we've been able to acquire. Um, for the well-being of these kiddos, because it is this affect co-regulation, and it can be so challenging.
It can. And trying, I mean, my husband and I try to use a lot of humor and sarcasm in the moment to just kind of break tension bubbles and shift. So we have like silly things that we say that would only make sense within our family unit, but it's like once you say them, it kind of changes the overall mood. Even though it's still hard, and even though we're trying to get through a difficult moment, it's almost like just that moment of taking a deep breath to go back under, right? And so, I think having that type of synergy or understanding and timing really makes a really huge difference, as you're trying to volley back and forth between whatever challenge is presenting itself at a given time, you know. Um,
Yeah, and speaking of that, when you think about community, when you think about support systems that we've kind of gleaned over in terms of like COVID and family situations, I feel like the community of parents who have children with specific needs, the support systems, whether they're medical, community, they're not very wide. Um, can you tell me a little bit about that? How do you experience that?
I mean, I think a lot of the times the systems that we tend to interact with have a blueprint, and it ends up being a bit cookie cutter. I mean, I think you can always find that kind of diamond in the rough provider who's willing to kind of keep going and pursue different things. But I think for the most part, it's more like at school, this is what we can offer you, right? Like as a sleep agency, like this is what we can offer you. Oh, didn't work. Sorry about that, etc. Um, One of my kids was diagnosed with auditory processing disorder, as I've learned a lot more about it. And so it's not a hearing problem. It is the hearing happens. It's the brain processing the message problem.
Mhm.
And so I live in a major metropolitan area, and it turned out there were two people in this 6 million person city who could possibly treat this.
Wow.
And so we pursued them both, and one assessed and one treated, you
Yeah.
know, but I mean, really, we were kind of on our own to like figure them out, find them. Of course, it was not covered by insurance, right? Like, but ultimately, at the time, my kids were in a school with a lot of people. A lot of the teachers had accents, and one of her challenges from an auditory processing perspective was certain pitches that
Mm,
come with accents.
right.
And so it's not the teacher's fault that they have an accent, and it's also not her fault that she could not clearly understand everything being set, right? And so, but it ultimately ended up being our problem, right? And so we got the treatment and worked around and asked for like more written instruction, that kind of thing. But it was more like, okay, well, let us know what you figured out. Like kind of a situation. And so I think if having to be constantly resourceful,
Yeah.
figuring out what possibly works and sharing it with each other, and then being able to stay persistent, and of course there is, you know, some real barriers to some of this because a lot of folks can't access so many different things for different reasons, whether that's transportation issues, whether that's economic issues, whether it's just overall access as a whole, because where they live doesn't even have these things. So that's the other part that's really maddening, is that you really are on your own mission to get this done, and that there really isn't this like amazing case manager that's like, oh, auditory processing, here's what you do, right? Like,
Oh
it's
God.
really each other. And
And the things that we don't know that would never occur. So one of my kiddos is deaf, and somebody, well, my mother said to me, "It's fine. He can hear everybody else. It's your tone. You can't." So I thought, oh, okay, I'm gonna have to use like a big loud voice for him to pick up those pitches. I have to like be inside of the speech banana tones that he can hear and listen to. But these are things that they don't teach you, or they don't give you a preview when you're pregnant. They don't say, hey, here are the 15,000 things that can happen that we don't actually give instructions for.
Mhm.
And that's the part that just whenever I get a new parent in who is facing a learning challenge, how to kind of catch up with the needs of their kiddo, I just want to give them a hug and say, if somebody had told you back then, you would not know what to do with that. Now we can have the conversation.
Yes, and try to share whatever you've learned. And I mean, it's funny because so many, like the generation above us and above them, would say that, like, think that these things didn't exist when they were kids, and it did exist, we just didn't identify or name it. And so it's not that the incidents of these things are happening more, it's that we're able to recognize them, be able to like say, wait a minute, this is something that we could intervene and potentially make life easier for our kids.
Oh gosh, yes.
And so I think that, I think that's another thing, is the intergenerational kind of sometimes it's easy answers. Like, if your kid's throwing a fit, tell them not to throw a fit. It's like, why didn't I think of that? Right. Like,
Consider
the easy answer is not always the answer that's going to work. And so, it's not. And also, I just think we are more attuned and aware of all these different types of challenges. And instead of being like, they'll be fine, we're like, no, how do we help support them in overcoming it? So,
yes. And when it comes to that intergenerational, transgenerational trauma piece, one of the things I think about is that there are lots of people who did not survive that, but we also don't talk about it. So if somebody got cancer 30 years ago when they were 3 or 4,
mm-hmm.
we're just not going to talk about that person who didn't survive. And now, when I think about the oncology ward is full of kiddos who have limb differences, or who have hearing aids, or who are completely there are these different things that we have adjusted to, thankful to the technology that has come up. So now, how are we doing this? And how are we getting to this place? Because I think, and Jana, I think that you and I have had this conversation before, where what we're not looking for is oh,
Mm.
no, it's more like, how can we teach our kids, whether they have differences in abilities or not, to interact with other kids and to interact with those parents without having this edge of how to be an ally as a parent.
Yes. Well, and to be able to expand our definitions of like what should be happening or not happening. Right? I mean, because if you have a very sensitive child like I do, when she operates in a sensitive way around peers, sometimes she just gets called a baby, right? Like, because in their minds, whatever my kid thinks is hard, that kid thinks is easy.
Right.
And so instead, being able to have a little bit more compassion around like, gosh, that's not hard for me, but I can see that it's hard for my friend or my classmate, and so, gosh, that must be hard, right? I don't expect the kid to come up with a solution, but to have a little bit of empathy around that. And same with giving each other grace. I mean, even even if you have an ideal circumstance for you with the ideal child for you, parenting is really hard.
Yes.
And so being able to really judge a lot less, support a lot more, listen, and believe each other, right? Like, you know, if your child has a fear, even if no one else around them has that fear, recognizing, yeah, fear is not rational. And it doesn't matter if it's not hard for anyone else, it's hard for this kid. So, like, how do we support them in this moment, right? And just kind of changing our overall views and just being more open and accepting, and just, like I said, expanding the definition around and just normalizing all these differences, because some differences you can see and some you can't.
Oh, that's a good point.
And so, but being able to just have patience and kind of have it just not be that big of a deal, right? Like, if some, I mean, I understand there's certain limits around certain behaviors, but if it's just someone who doesn't like the texture of a food, right? Instead of telling them that it's really delicious.
There's a different food.
Yeah, here, exactly. That's what I'm saying, right? Like, just having a little bit more flexibility. You know, yes, there's certain behaviors that nobody should support because they're not safe. But outside of those, being able to, oh, okay, so you don't like that? No problem. Let's do something else, right? And it kind of not making anything a problem, um, you know, and being able to just expand that so that more people can feel included and inclusive. And what you find is a lot of the times neurotypical stuff can be really boring. And so being able to have more diversity in play, in the way you think about things. You know, my neurospicy kid is the best storyteller on the planet.
Oh.
Okay. Like, unbelievable. This child can take a pile of Legos and make the most amazing things, like, just to scale, like, in her head. I mean, there's just so much talent. She can solve a problem like no other, but you can't necessarily see those things on the playground.
Yeah.
Right. So it's being able to appreciate and take the time to get to know someone and some of the beauty within, even if they're not as into some of the same things your child's into.
Oh gosh, 100%. And I wonder sometimes if we're trying to focus on the beauty that is within every person, it doesn't mean that we're negating these other things that might be challenges. But there are parents who I know who have much more challenging medical and just situational things, but they still love their kiddos.
Yeah.
Right. So I wonder how we can help create community around people when their kid is not the one who's being invited to maybe all the parties, or the kid who is having an easy time in the classroom, or who is great at sports. Um, yeah. So how do we create that community for parents? Because I know we do a really good job of creating a community for maybe birthing people who have had difficult postpartum periods, or
Sure.
birthing people who might have had just different challenges. But I feel like as we get farther away from that birth, we have less community. So I'm wondering, like, how to.
I agree. And so, I mean, I think sometimes you have to create the community in the space that you exist within. And so sometimes that is within the interest area of your kid, right? Sometimes that is the educational place that they are, right? Like, so wherever your kid spends time, because I think it's really easy to other people you don't know. And it's a lot harder when you start to establish relationship or get to know each other better or have some more rapport, which I know takes extra effort, which is hard as the parent who's tired. But I think that once you see people multidimensionally as actual people and people within your community, then I think it's easier to look at some of those differences in a different way and be able to see those commonalities. And so even though you may just want to sit on the bleacher and have a quiet moment, do that and then go start talking to folks, get to know them more, right? Like, because I don't think anything in this world really replaces personal connection and being able to be with people and have them experience you, in with all the flaws that we have, but all the goodness we bring too. And so, I mean, that's the whole point of being human is we have strengths, we have challenges, we have things we're proud of, we have some things we wish were different, and it's just a question of how visible that is and how much we let people see it. And so being able to recognize and self-reflect on our own challenges would then just allow us to be more open, and I think that's part of it, So as I talked about, not really accepting help that easy with a stroller. If I happen to be by myself and I see a parent struggling, I always offer. And they always look at me like I'm crazy. I mean, not to take their kid or anything, but like, can I hold that package? Can I open the door? Like, I wouldn't interact with a child I didn't know at all, but like, and they just look at me like you are crazy, right? Like, but I'm like, I've been there, like it's hard. And so I think just trying to get back to supporting each other where we can, connecting where we can, even if it's short little bursts, and being able, the internet can be a wonderful place. You can help you span a lot of different miles, but it's also really important to have actual people in your community who can do more than just listen, and who can potentially help, and that you're able to switch off with on different things or tag team and, try to lighten the load where you can. But it's always a challenge. I mean, at the end of the day, I do not think that our entire system is set up to support families. And so when we're struggling on some level, I'm like, well, yeah, we're not set up to be supported. So it's really easy to feel like you're failing.
Yes.
And in reality, we're all trying to solve a systemic problem individually, and that's not how that works. And so, we can fight against it the best I'm not saying give up. I'm saying trying to recognize, like, the reason this is hard is that we don't have the systems to be able to really support our families with whatever needs they bring, and that we're the ones who are going to have to change that, right? Like
fixing the medical establishment, fixing the educational establishment, yes, absolutely.
Completely. And I think, that feels daunting, but it doesn't mean you shouldn't try in your own way, in your own space, in your own time, because I do think that's what ultimately makes the difference.
I love that. Yeah, Jana, so can you so you continue to educate and nurture the therapists who are in this community. Can you tell us what is on your plate, what's coming up for you? Because I think that you have some upcoming trainings, but you also are scheduled for several other trainings in the next 6 to 8 months.
Yes. So the next thing that's coming is called Connecting the Rainbow, Healing Perinatal Trauma. And so that came about from, there's a lot of good trainings out there that really hone in on a specific part of trauma for a birth giver, like specifically birth itself, or there might be trainings on struggling to conceive. And so I tried to fill the niche by really looking at all the different stages and phases through the journey to parenthood, starting with our own childhood and what we bring to the table when we think about becoming parents, through conception challenges, pregnancy challenges, birth challenges, and postpartum, but really seeing that across that continuum, and trying to find sustainable solutions, because absolutely, birth trauma is real. So is conception trauma, but also being able to put a spotlight on the other lesser noticed aspects that end up being very powerful for folks. So it's coming up October 25th and 26th. You can find more information at Touchstone's website. I also train folks in brain spotting, but I specifically do that through the perinatal lens. So it's the same curriculum as any other brain spotting phase 1 and phase 2, which are the introductory phases. But all of the examples, all of the demonstrations, and all of the practicum are more perinatal focused, so that you have a good understanding of how to apply that with that particular population. And it's such a beautiful, beautiful way to help people heal, because ultimately we go through a lot to become parents. The least we should be able to do is enjoy our role as parents. And I feel like brain spotting is integral in making that happen. And I'm also currently forming a training that will focus on addiction and sobriety through the perinatal period. I think this is hugely misunderstood. I think there is tons and tons of judgment and misunderstanding just around substance use and abuse as a whole, and that it gets especially polarized when it comes into the realm of pregnancy. And so focusing on best ways to support people through this period, because, you know, lots of different people in lots of different phases of their own sobriety or lack of get pregnant. And so how to minimize risk and be able to have a supportive environment for people to move closer towards sobriety wherever possible. So that's the kind of things that are coming up. Love doing the work, love teaching people about it. It's so, so passionate for me, and really coming up with ways for people to be able to truly heal on the deepest levels, and feeling like even though these horrible things happened, that they're able to move forward and have the life, even though it wasn't exactly as they expected, to have a life that they feel proud of and feel good to live.
Well, I will be the first person to sign up for your sobriety in the perinatal period training, because I got to do your Tuesday tea for that, and I was just blown away by the amazing amount of info that you gave, and I can't wait to learn more. People who have come from Connecting the Rainbow and brain spotting, a lot of people who I know, a lot of professionals who I work with have just raved about it. So I can't wait for this next round.
Me too. So anyone who has the interest, definitely go to touchstoneinstitute.org and look up all the information and sign up, or look at the other fabulous offerings, because it is a really impressive roster of instructors, and I'm proud to be a part of it.
Thank you so much, Jana. Thank you for your time, and you have a beautiful Tuesday.
Thanks. You too. Have a good rest of your day.
You too.